Practicing safe hygiene is critical to the health and wellness of you and those around you. There are many simple but effective ways that can slow the spread of COVID-19 in school, such as properly wearing a mask, socially distancing from others, cleaning the surfaces around you regularly, washing your hands properly and thoroughly, and practicing good respiratory hygiene. Droplets that come from a person's mouth or nose when they cough or talk are one of the leading causes of transmission of COVID-19. It is critical to properly wear a mask and socially distance from others to help prevent the spread of the virus. To properly wear a mask, be sure to have both your nose and your mouth covered when in a crowd. If you need to take off your mask for any reason, do so at a distance from others, and if possible, outside. When you are finished wearing your mask, remove it by grabbing the mask's ties and place it in a trash can. Littering personal protective equipment can cause a virus to spread faster and easier. After discarding your mask, be sure that you do not touch your face until you have washed your hands thoroughly for at least 20 seconds. Another way to slow the spread of COVID-19 is through social distancing. Airborne transmissions are one of the leading drivers of the virus. By maintaining a social distancing of 6 feet, the chances of coming into contact with droplets containing the virus are minimized as much as possible. Many people who have COVID-19 are asymptomatic, so it is important to maintain social distancing even if you are feeling healthy. If you are showing any symptoms of being sick or don't feel well, stay home and refrain from coming into contact with others. A third way to slow the spread of COVID-19 is maintaining a clean working environment. Many areas of a school are a shared workspace and should be cleaned and disinfected after each use to ensure the safety of those in the building. This includes computers, desks, writing utensils, chairs, door handles, and any other surfaces that people have direct contact with. After wiping down a surface, let it remain wet for 5 to 10 minutes if possible for it to be fully disinfected. It is also very important to wash your hands often to slow the spread of the virus. Key times to wash your hands include, but are not limited to, before eating food, before and after treating a cut or wound, after using the toilet, after blowing your nose, coughing, or sneezing, after touching garbage, after you have touched an item frequently touched by other people, and before touching your eyes, nose, or mouth. To wash your hands properly and thoroughly, follow these important steps. Wet your hands with clean, running water, turn off the tap, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. If soap and water are not immediately available and you need to clean your hands, you can also use hand sanitizer. Sanitizers are not as effective as washing your hands and should only be used when soap and water are not available. To apply hand sanitizer, rub your hands together with the gel until your hands are dry. The COVID-19 virus spreads from person to person in droplets produced by coughs and sneezes. Therefore, it is important that students and staff cover their mouths or noses with a tissue when coughing or sneezing and dispose of the tissue appropriately. A supply of tissues and no-touch trash cans should be available in each room when feasible. If no tissue is available, using the inside of the elbow or shirt sleeve to cover the mouth or nose is preferable to using the hands. Always perform hand hygiene after sneezing, coughing, and handling dirty tissues or other soiled material. By following these simple guidelines, we can keep our schools and our community as safe as possible.